So now we're going to talk about amoxicillin, which is a very well-known antibiotic. So, and again, this is based on MIMS Asia. So famous brands include the amoxicillin, and the dose for adult and children above 12 years old is 250 to 500 milligrams TDS 3 times a day, and the maximum is 4.5 grams a day. So for severe or recurrent respiratory tract infections, so if it's very severe or it's recurrent, then you can, from just now the dose of 250 to 500 milligram TDS, which is about 1.5 milligrams a day, so you can increase it to 3 grams twice a day. In cases of uncomplicated endocervical and urethral gonorrhea, so a single dose of 3 grams of amoxicillin with probenecid 1 gram will suffice. And in cases of dental abscesses and uncomplicated urinary tract infection, 3 grams repeated once after 8 to 12 hours is okay. And in chlamydia in pregnant women, it's 500 milligrams QDS or 750 milligrams 3 times a day for 7 to 10 days. And for prophylaxis of endocarditis, 3 grams 1 hour before the dental procedures under local or no anesthesia, followed by 1.5 grams of amoxicillin 6 hours after the initial dose. So 3 grams 1 hour before the procedure, and then 6 hours after that you give 1.5 gram. That's for prophylaxis of endocarditis. For H. pylori associated gastritis or peptic ulcer, it's 500 milligrams QDS or 750 milligrams 3 times a day. Lyme disease, 250 to 500 milligrams TDS 3 times a day to QDS for 3 to 4 weeks. Children less than 10 years old, generally it's 125 to 250 milligrams TDS. So it's about half of this 125 to 250 milligrams TDS. And then children below 20 kilograms, it's 20 to 40 milligrams per kg per day in 3 to 4 divided doses. So for example, a 10 kilogram child, so for a 10 milligram child, it's 200 milligrams, so divided by 4, so about 50 milligrams 4 times a day for a 10 kilogram child. So in otitis media, children 3 to 10 years old, it's 750 milligrams twice a day for 2 days. In uncomplicated endocervical and urethral gonorrhea, a single dose of 50 milligrams per kg per kg of amoxicillin with probenecid, which is 25 milligrams per kg in prepubertal children with uncomplicated endocervical and urethral gonorrhea. So gonorrhea. For Lyme disease, it's about 6 to 13 milligrams per kg 3 times a day for 10 to 30 days. So administration of amoxicillin is can be given with or without food, not an issue. So the presentation includes, we have capsules of 250 milligrams and 500 milligrams. So remember that this is an Asian kind of dosing, so it might be different in the US and UK, etc. So Amoxicillin granules for oral solution is 120. We have Amoxicillin granules for oral solution, 125 milligrams for 5 mils. Okay, which is 25 milligrams per mil, and also we have the 250 milligrams per 5 mil, or 50 milligrams per mil. And Amoxicillin tab, 250 and 500 milligrams. So indications for giving amoxicillin include bronchitis, okay, inflammation of the bronchus, infection of the bronchus, pharyngitis, okay, bacterial pharyngitis, pneumonia, sinusitis, okay, other sorts of, and then we have urinary tract infections, okay, we have acute otitis media, mouth infections. I know this list, the sequence is not that good, so but you can, probably can figure out yourself on the better sequence. So we have mouth infections, gastroenteritis, and also as an adjunct for H. pylori associated peptic ulcer, and then biliary tract infections, and also uncomplicated endocervical and urethral gonorrhea. So it can be given for uncomplicated endocervical and urethral gonorrhea. For Lyme disease, for typhoid fever, okay, salmonella infection causing typhoid fever, and then alternative to erythromycin. So it can be an alternative to erythromycin for chlamydial infections in pregnant women, and also can be used for prophylaxis in spleen disorders, and also for bacterial endocarditis. Okay, so remember that amoxicillin can be used as a prophylaxis for spleen disorders and bacterial endocarditis, so this is a very important drug. Notable contraindications include penicillin allergy. So if someone is allergic to penicillin, then you would not want to start the patient of amoxicillin, because this is quite obvious. So interactions, it may reduce the effectiveness of oral contraceptive pills. So this drug is most probably a cytochrome P450 enzyme inducer, okay, causing increase in the metabolism of OCPs. So it will reduce the effectiveness of OCPs. And this drug, when combined, amoxicillin when combined with allopurinol, can increase the frequency of skin rashes. When used with probenecid, so probenecid can reduce the tubular secretion of amoxicillin in the kidney, so we'll have a prolonged effect of the drug. And also it may reduce clearance of angiotensin converting enzyme inhibitors, okay, so might cause protoxicity of ACE inhibitors, and then reduce clearance of potassium sparing diuretics, and also potassium supplements, and also methotrexate. Side effects or unwanted effects of the drug include GI disturbances, vaginal candidiasis, pseudomembranous colitis, okay, and also allergic reactions. So since that the drug can cause GI disturbances, so the drug can be taken with food to reduce potential GI, gastrointestinal discomfort, okay, tummy discomfort, and also allergic reactions can be an unwanted effect of amoxicillin. So pregnancy category B, okay, not too bad, but it's not A, so still be cautious in using this drug. So, but with regards to lactating mothers, unfortunately we don't have, there is no available information with regards to this. Okay, we'll see you again in the next video. Thank you, bye.